not inserting. You have learned about putting a cannula. That is a different scenario. But in talking Manica scenarios, it's not just you stand and talk. Meantime, it is not you have to really actually do it. It's somewhere between. Okay, if you stand and there, maybe they may not happy with that. You need to walk in and okay, pick up that cannula, come near to the patient, examiner will tell you as you've done. You put the cannula back. You need to be a little bit faster. Okay, they will appreciate it, put the cannula back. Same thing, if you need to give a fluid, it is not standing and talking. No, you may have to walk in it, pick up the saline bag. If you need to give an adrenaline or hydrocortisone, okay, you need to open the trolley. The trolley will have medications. You need to pick up the right medication, for example. Okay, they will have medications like this. You have to pick up the right one. For example, adrenaline, they will have in different concentration. 1 in 10,000, 1 in 1,000. Salbutamol. What you need to do, you need to go and pick up and come near to the patient. Then the examiner will tell you as you've done. Imagine what is going on. Imagine your position as a doctor, talking American. It's very easy for you to listen, but when it comes to acting, you cannot, people, okay, they freeze. Go blank. If you don't practice, it will not work. Right, good. So you have to pick up the right medication and come. Let's say the scenario is related to bleeding. Related to bleeding. Then you have to continue your examination. Okay, if it's bleeding, you may have to, if it's abdominal bleeding, you may have to do abdominal examination like inspection, palpation, percussion, auscultation. If there's a bleeding from the perineum or upper GI bleed, you may have to do abdominal examination. Or you need to examine the vagina. Things like that. You might have to examine further if it is a bleeding. That is C. So you have to do it for real. Pick up the fluid and hang it on the stand. Then now D for disability. Here the theme is insult further. Prevent further insult. So, which organ we are focusing in the disability? First one is for trachea, airway, breathing for lungs, circulation for heart. Disability, it is brain related. So what can insult the brain? Like hypoglycemia can insult the brain. Sepsis, high temperature can insult the brain. Bleeding can insult the brain. So what are we checking here? We are checking conscious level. Either GCSU or AVPU. AVPU means either you say patient is A for alert, B verbal, responding to verbal stimuli when you call him or call her, he's responding, or only responding to the pain or unresponsive. Normally alert. You check the pupils. Pupil capillary constriction. That's why there's a torch. You can check the papers. You might have to do capillary sugar, glucose. You can also review the ABCD of the patient. You can go back and look at the screen. That is disability. Okay. Then the next one is E for exposure. So exposure, which organ? Which organ? Cutaneous, skin. So you need to examine the patient head to toe. Maybe the hidden parts like back, genital areas. Expose and euthermia, that is the theme. Maintain the euthermia. Thermia, temperature is not a problem in our countries, developing, third part of the world, temperature countries. But here it's quite important. Temperature. The patient is not covered properly, okay? Enzymes wouldn't work. Body, you cannot cope with the fighting. So then you may have to put catheters. Wait for investigations. Some other treatment, admission, or further management. So the further management, admit seniors, doing other investigations, antibiotics. Then you can also take the history as well. You take the history in acutely with the patient when they become stable. History will not save the patient. ABCD assessment is designed in a way to, save the patient. You don't need a history. Have a breathing circulation. From the findings, you need to identify and treat. But one thing you can do throughout this ABCD assessment, you can ask vital question time to time. Do you have any medical problem? Do you take any medication? Allergy medication? I see some blood. So did you vomit any blood? Or how long had these symptoms for? Duration. How did that start? So a couple of questions. It can be random questions, but you have to have a reason to ask those questions. That is ABCD assessment. That is all about today. Let's go to the scenario now. So understand what you need to do. You need to verbalize. You need to talk outside. Not only you say, you also act as one. You need to move around. So let's look at the first scenario. First scenario is asthma. Acute exacerbation of the asthma. Let's see the scenario.